Good morning. This is the, I believe, final meeting of the contract subcommittee for the DHSS Reorganization Committee. My name is Carolyn Petrak. I am the Associate Executive Director of the Ability Network of Delaware, and I'm the co-chair of this subgroup. I'm joined by my fellow co-chair, Representative Krista Griffith, and members. I'd like to get this meeting called to order. It's 11:02. The agenda today should be fairly light. We have a final read through of our 5 proposed recommendations to the full DHSS Reorganization Committee. I'd like to go over them again. We made edits based on our discussion at the last meeting on the 29th of March. 3 that were proposed then. Based on the committee's feedback, we have 2 new recommendations based on the remaining issues that were of concern to committee members. So we can dive into them as well, but let's real quick go into recommendation number 1 to finalize, unless anybody has any questions general questions before we get started. No? Okay. Then I'm going to hand off recommendation number 1 to Representative Griffith. I don't think there was any substantial changes. You should have all gotten these a couple days ago to read through. Hopefully you took a few minutes to do so. And if you have any questions or edit, now would be the time to discuss.
Good. Yes, thanks, Carolyn. And good morning. I'm trying to pull them up. I was trying to do that earlier. Oh, here we go. Sorry. I have them here. So basically, this is essentially what we discussed from last meeting. The difference is I think Lynn raised the issue of what to do to make sure that, again, here we go, to make sure that the contract is accessible to the contracting party. I think the issue of making sure that that whatever contract management system the department maintains, that it's not just one-sided, and that there's the ability for providers to get access to that. So I think the change was, I'm just trying to locate that. But if we want to go through it again for just recap purposes, if you could pull that up and review it and ask me any question, I'm happy to address it. But again, the point here was to make sure that rules and regulations were in place to make sure that throughout all divisions, the contracting process was even and understandable, so you didn't have to worry about one division doing one thing and another division doing another thing. The contracts were stored in a secure fashion, and that they were secured uniformly, so that you didn't have some divisions storing them in a file cabinet versus having them available electronically. So hopefully recommendation 1 accomplishes all those goals. So any changes or questions, happy to hear them.
I have, this is Pam Ruther. I do have a question with regard to the uniform, the single system that is currently in place. My question had to do with my original understanding was that an agency would have a single, would be able to access documents that they had submitted for other RFPs and pull them into new RFPs. I understand that we can have multiple users from a single agency, all have different accounts. So on our end, we could potentially have 8, 10 different users with 10 different contracts that are accessible, but as a COO, I can't access all of our contracts. So is there any movement toward having a single access point for, say, using the federal tax ID number as the entry point for an agency versus the individual users that can sign up in Bonfire?
So that's a good question. I think that's a good fact-specific question for the department to answer. I think, so I would hope that, so I'm trying to think that's a good, that's sort of a very technical question that this I think address that the issue addresses broadly to make sure that access is even fair, but I think that you have I don't, within the recommendation realm, I don't have an answer for you, Pam, in terms of the specificity of what bonfire can or cannot do. So I would defer to the department on that and hope that they would answer your question and address that issue. I don't know, Carolyn, what are your thoughts on that particular question?
I mean, I would love for it to be optimized, the system to be optimized in that way and in other ways. I don't know how we, other than to say, I mean, I'm open to something general to add, but I don't necessarily want to muddy it down with a technicality. So,
Right.
I think, Kim, if you have any insight into whether it's a, it's a module that Bonfire can do, if it's a plan of the department to move towards that, or your perspective on it, it might help us decide whether it needs to be in the recommendation, or if it's just something we have to discuss in another sort of.
Yeah. And I will say, I didn't mean to muddy up the actual recommendation, except from the perspective of when you talk about access for an agency. Sure. For the contract management, it becomes person specific on the agency end, right?
No, that's an important perspective.
Right.
Correct.
Sorry.
Right now, I believe it is whoever submits the information has access to it. No one else does.
Right.
But it may be that just it could have access to those with the same domain. I don't know. I can check with Bonfire to see if that is okay. Available.
Okay.
Hi, this is Andrew. I thought we had made the determination that Bonfire was not something that was going to be able to be used for contract management. I think I thought that was a discussion a couple meetings ago, that it was working well for the submission of a proposal, but as far as contract management, it didn't have that capability.
No, it does have that capability. We have contracts and RFPs that we can process and manage.
Okay, thank you.
I think the initial, I think what you might be you might be thinking of, Andrew, is that the initial launch of Bonfire was it back last spring was to get signatures remotely because we were rushing to quarantine.
That's DocuSign.
DocuSign, right. And I think when we came back together, Michelle was reporting that they were incrementally getting into more use and more use. But I think optimally, it has a lot more potential. Am I correct?
Yes, and initially we did just start RFPs because that's what our push was, to get all of the RFPs in because we were in quarantine. But then the contracts piece did roll out, and it's been active for the past 7 or 8 months.
Great. So Pam, I don't know if that answers your question. I know, Krista, what your thoughts on that? I don't want to like try to micromanage within a recommendation. I'm not saying it's not a relevant point, because it is a very user-friendly, provider point of perspective that I think is important. But I don't know from the perspective of the recommendation how to.
Right. No, the recommendation can't dictate what company, the department uses. It needs to just basically include the high level points of what it should accomplish. And so I think Pam has a really good question, and we should try to see if she can connect with the department to try to figure out if the Bonfire can accomplish what she's suggesting. But again, that just to make sure that we have so to the point of with the recommendation, is there anything missing in that you want as providers or public or anyone to see in terms of the department's contract management system? I don't know, Kimberly, have you seen the recommendation?
Yes, I have it.
And how do you, any response at all from the department on that?
Our Bonfire does provide a automatic renewal system where you can get notified when the contracts do need to be reviewed. And so I have no comment you know,
Okay.
other than we do have
Okay.
some systems in place.
Right. Okay. All right. Good. Okay. So it's just basically to kind of take what the, basically to make sure that we have that uniform, even, fair, up to date 2021, maybe even 2022, system that, that kind of, that brings up, improves our standardization and efficiency and performance of contracts. Okay.
Yes, and we do have that in Bonfire.
Okay. We just want to make it across the board with the department. All right. I think that's it for me for recommendation number 1.
Okay. Yeah. And I think that if, this work has been going on for well over, I think, like 18 months now. So if the department has evolved, or this particular, if you're already doing it, that's great. Ultimately, if this makes it into the final cut, it's an easy thing to check off your list. But I don't have any further comments. Do you want to vote individually, or do we want to vote totally?
Let's do it totally, unless there's, I don't see, I guess we should make, unless there's some part of this group that feels that any of them are controversial, then I don't see there's a point of taking them one by one.
Yeah, and then the individual edits, again, when we make a motion, we could say pending the aforementioned changes for edits, whatever. Okay. All right, so then we'll move on. Recommendation number 2, we've just had some slight wording changes. Again, hopefully you've taken a minute to look at it. Please review and let me know if anybody has any questions or concerns or changes, or pick up any typos, because that's certainly possible. Good.
Carolyn, can you just say to me, so we've added the piece about the indirect rate.
Mm-hmm.
However, existing contracts with overhead rates that exceed any new standard. So that means if the department said, okay, we're doing a standardized overhead rate of 15%,
Sure.
but I had a federally negotiated rate of 17%. I don't, but if I did, you're saying that because of the new standard that's been set, we wouldn't automatically then lower that existing contract to meet the standard.
Yes, because that was one of the points that was made in the last meeting, was that some contracts and some divisions are over what basically what the floor is, or what the minimum is. So if we changed that, we didn't want existing contracts or existing service providers to be penalized and have their rates that they've been operating on lowered. Yes, Sheila. You're muted.
Would it help to say the sentence that reads, the department shall, and put minimally follow? So, I mean, we certainly would encourage, because we know that even the federal overhead rate is not sufficient for what it really costs to serve. So if we put in the word minimally, then it gives the opportunity for the department to go higher.
I mean, I would defer to the service providers that actually sign the contracts and have to operate their business. I mean, the purpose of the second sentence was to make sure that we're really addressing that they reflect actual costs. Now, regardless of that, if we need to be more specific, I'm fine with it, but I would defer to the service providers that are in the subgroup. They have the best, I would say, perspective. If you think there's another catch that needs to be in there for clarity purposes.
In our experience, our contracted rates are often lower than the federally negotiated rate.
Mm-hmm.
So to me, this would improve my currently negotiated rates with the state,
Mhm.
However, to Sheila's point, I get what you're driving at, that just because the feds have given me 15 and I know it really costs 18, we've put a new cap, like we kind of moved the cap from where it may be up a little bit, but still may not be where it needs to be. Is that what you're saying, Sheila?
It was really just to offer a recommendation that they minimally follow the guidelines and to create opportunity if they want to negotiate higher, that's all. I was, was just trying to address what I thought I was hearing you say, Kirsten.
Lynn, you look like you're concentrating.
I wonder if, I like the idea of adding minimally, and I wonder if reordering the sentences so that it ends with rates shall reflect the current costs and operational needs of contracted partners, putting that last so that it's the final, like the be all and end all, like.
That makes sense to me. Lynn, you were going to say something.
I think that's a great idea because I think everybody has the same kind of thought that while we all want to see a standardized rate, there's concern about which way that rate may go, and we all could end up worse off than we are currently.
Okay. So Sheila, you're saying sentence number 3 that starts the department shall follow. You want the word minimally in the department shall minimally follow. Is that what you're saying?
That was a suggestion, yes.
Okay. Okay, and then the sentence rates shall reflect should be last, and this should be first. 1, 2, only 3 sentences in that one. Okay. So then just for clarity purposes, I'll read what it would read, and then that way we don't have to, we can lump it in. The department shall standardize the overhead and indirect cost rates used in contracts throughout divisions. The department shall follow minimally federally negotiated indirect rates. However, existing contracts with overhead indirect rates that exceed any new standard shall not be automatically lowered. Rates shall reflect the current costs and operational needs of contracted partners. Anything else? Once? Good? Okay. If anybody has a light bulb or whatever, we just put a pin in it. We'll come set when we finish the 5th one, we'll come back to it. Okay. Recommendation number 3, reduction in use of external consultants and investment in in-house expertise within the Department of Health and Social Services. Please take a minute if you haven't already done so. Let me know if you have any changes or substantial concerns. Jeannie, I know you said there was a thing, but I wasn't following what.
Yeah,
it's point out where you're talking about.
yeah, it's the department shall invest in full employing. That should be taken out.
Right,
And it should be in full-time employees.
Employing, okay.
Yeah. Alexa and I were talking about this beforehand. And this is more of a personnel issue. So, but it's encompassing this recommendation, I feel. Do we know, maybe this is the way, do we know why the department relies on outside contractors so much?
Well, the overall conversation in the full reorganization committee meetings, especially when personnel subcommittee had reported out, was that part of the reason, I can't say with certainty, but part of the reason was that a lot of FTEs were eliminated when the recession of 2008 hit, and vacant positions were eliminated or moved to different places within the department. And it was really shaved down. The capacity of the staff was really shaved down when we were, the budget was in crisis and we were running in a deficit. And as things recovered, those positions were not recovered. So to some extent, I can't say that that is completely the reason. To some extent, it's filling holes, but they're relying on them long term. I think part of it, especially in certain divisions, is that they're going for a lot of big pots of federal money, and they need someone to manage those grants, which isn't unheard of, but not on an ongoing basis and not at the point of administering the operations of a specific program or division as a whole. So that's the.
Well, that's, and Carol, I have a question. I don't know that I like the word divest in the last sentence, because again, if there's like, if using these services actually brings opportunities for Delaware and additional resources, then I just, the term divest seems a little.
Yeah, I mean, I mean, that's fine. I've changed the word if you don't like the word.
Shall also reduce reliance where appropriate. I mean, I don't know. Like, again, like, I don't, if there's, if some consultant knows best how to bring in grant money to the state, we want to do that.
It's not, yeah, it's that happens for certain. What I didn't, and maybe Kim can, not every division needs a large external contract to write a grant.
Right.
Write for a grant.
This is good. And this is a good recommendation. I think it hits that point home that where possible, let's do this in-house. Let's train our employees to handle these things. But if we could, in that sense, just say the department shall also maybe reduce reliance where
a lot of what I cut out was providing the perspective on why this is why this is an actual concern, because of the recession and governments are so thin that instead of building back the staffing that normally has people to manage these larger programs and projects, there is a need. Again, this is what I cut out. There is a need for that sort of expertise, like with the rate rebasing projects, like the large one. Those are national experts. There's only a handful of people that do that and know how to do it well. You want consultants for that work. But if the department is going to have this now be an ongoing basis, so we're not always scrambling for to find out the true cost of services, and we're not always coming at the General Assembly, every other year that this line of service needs a rate study and this, then that's going to be sort of ongoing. So instead of necessarily retaining a large national consultant for an extended or indefinite period of time, that there's a balance between in-house expertise and institutional knowledge within the department, and then utilizing the expertise of an actual consultant.
All right. So how would you feel that in the last sentence say the department shall also reduce reliance where appropriate?
That's 100% fine with me.
Reduce reliance where appropriate of external consultants. And that way that again, we're pushing that point that let's first look to see what we can do here.
Yep.
And then having that option where appropriate to.
That makes 100% sense.
Yeah, I think that's great. That really does look at and address my concerns, because what if there aren't people out there that can do the job? It's as simple as that. And to say where appropriate at least allows the department to do what's necessary to bring in the people that can do the job. So that's great. Thank you.
Yeah, it almost lends itself to the difference between a project-based consultant versus like a short-term finite period of time versus paying ongoing consultants for, undefined periods of time. I get that the idea of limiting the cost to the state, there is a definite immediate cost to hiring FTEs, but there's also a long-term impact to our budget with state employees that stay on, and then add to that layer, at the other end of retirement costs, right? So I get it, but it comes down to, I think what you're saying, Carolyn, is project-based. If it's more than project-based, we should be looking to develop that skill in-house.
Yeah, exactly. And and I think I say this every single time we meet, but it's so hard to not overlap with the work of the other subcommittees, but the personnel subcommittee is actually looking at the personnel issues within the department and that lack of staffing up and expertise. And so,
Well, the good news is we're all on the
We're
same
all-
page, right?
exactly,
We kind of support the efficiency movement. So
Right.
that's a good thing.
Right. Okay, so that with that edit, and with the extra superfluous word that Jeannie pointed out. Kirsten, you're lighting up. You're not lighting up? Oh, okay. Okay, recommendation 3. Turning the page. Okay, now 4 and 5 are new, not new in that we've never talked about this subject matter before, but new in that you haven't seen it as a recommendation before. So again, I think that given we haven't talked about it before, I think I'd like to at least read it through and make sure that one, it is consistent in the way we're wording and structuring things, but then make sure everybody has read through it. So Sheila, thank you for providing this and doing the work on this. If you'd like to read it through for us, and then we can have a discussion. Just read it straight.
Okay. Do you want me to read the whole thing?
And I, since nobody's heard it before, I'd prefer that.
Okay. So again, please, I just did my best, but welcome any input, feedback, change.
And it's much appreciated.
So this was a recommendation to respond to service provider concerns. In order for the department to improve its contract management effectiveness and its partnership with service providers, the department shall establish a mechanism to independently review service provider concerns. Concerns raised could include actions such as unannounced changes to contract scope, revision to contract reporting requirements, delays in payment, delays in contract renewals, and other actions counter to department contract policies. The independent mechanism or process should be established to review these concerns in a manner in which service providers will not be negatively impacted due to raising concerns. This mechanism would be objective and would provide opportunities for continuous improvement, be transparent in identifying areas that need to be addressed, and hold the department accountable to the policies and practices it values. And then more specifically, this mechanism would ensure that service providers are entitled to independent representation at each step of the grievance process. And again, use the word grievance as substitute for concerns. Service partners may have an independent representative each stage of any investigative process. Service partners are not coerced or intimidated or suffer any reprisals, either directly or indirectly, that may adversely affect their contracts, rates, or working conditions as a result of the exercising of their right under this mechanism. And then contract provisions with service providers shall be applied without discrimination as to race, color, national origin, marital status, age, gender, sexual orientation, religion, and disability.
I really like that, Sheila. Nice work. My only comment would be, it seems to me that last bullet could be its own bullet. That to me operates independently of a concern that may be raised. That's my take. That no matter when we're contracting, whether we have a concern or not, contracting should occur without prejudice towards any of the things that you have listed.
Yeah, and I'm not suggesting that that is not happening today. It was more as we were researching other ways in which this, language around having an independent kind of process that was built into it. And so I incorporated. So I appreciate that, that perspective, because I agree with you that it really should happen no matter what, right?
Sorry, I'm on mute. So Kirsten, so do you want to take it out and just have it be its own recommendation? That's not something specifically I'm not saying it's not a concern, or it's not something we've talked about before. Would you like that to be its own recommendation, or do you think that it is a baseline, like a base statement somewhere. I'm confused.
I mean, to me, it's really important. I think to Sheila's point, and to your point, it's not something we've talked about. I don't think it's something that has been raised as a concern. So I don't know if it's sort of outside the scope of the work that we've done, but to me, it is really important. And it doesn't just live in a provider complaint or a provider concern.
Okay.
But I'm open to what others think.
I personally think that it deserves its own space. But
So
as-
do I.
I agree that has significant value. My question would be that if we are putting this as a recommendation, is there any potential that there will be an assumption that there's a problem already in existence?
yeah.
If there is, we should definitely put this forth as a recommendation. If there isn't, should we include an opener that indicates that while this is not a problem or an identified problem, the committee felt that this was important to include as an
Right.
ongoing recommendation?
Yeah, no, I think Pam, you hit it right there. Like we could say, and I think we could wordsmith this right now, like something like the committee recognizes the importance of, preventing discrimination and the provision of or something to this effect.
Right.
The committee, and we don't have to necessarily say we don't see it happening. We do see it happen. We're just saying as a general principle, or as an important principle or whatever the words are, as a general
guiding principle.
a bedrock principle.
Right.
The committee recognizes the how important it is to not deny contract services based on,
Right.
and that could be a recommendation. And again, we're not saying the department needs to award X percentage of, we're not weeding and
Right.
getting into the woods of what might be not legal, in terms of mandating, percentages and all that, but we're just saying, don't, you're open to all, you're not, right.
Yeah.
And I do
Just want to be careful since people,
Yes, yeah.
people, unfamiliar users will look at this
Right.
as our recommendations because there's an existing problem.
Yeah.
I want to make sure we
Yeah, no, that's
couch it
a
appropriately.
good point. And I love that Sheila put this in the recommendation. I love that Kirsten wants to pull it out and make its own recommendation.
I do
think
too.
that's nice. That's nice.
Okay. Okay.
I do think we should get that language down though now as an official and not wait for that to be a
Yes.
follow-up because it's a substantive rather than technical change. So should we do that? Make sure we spend a few minutes right now writing it.
Yep.
Is that-
Yeah.
All right. So let's give Carolyn some ideas here. What do you have so far, Carolyn?
I don't even read my own handwriting. I just wrote it as a guiding principle, and then whatever word you just had said as a baseline.
How about what's our committee's full name?
The contract subcommittee.
Okay, the contract subcommittee of the, Alexa, what is it, of the DHS?
Reorganization, the DHSS Reorganization Committee.
Okay, there we go. That's our little start.
That's a mouthful.
Recognizes or, I don't know, Kirsten, do you have any ideas here? Or Pam, Jeannie, anybody, like what we should say, not recognizes, but let's see.
Could we say something like it's almost, it's like as a guiding principle, as a guiding framework for contract awards, this subcommittee of the committee recommends that.
And then you go into the bullet.
Provision, blah, 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 blah.
Okay.
I think that works.
Okay. So I have the only outlier is the word principle, framework, or something else as a guiding
I think principal.
principal, the contract subcommittee of the DHSS Reorganization Committee believes all contract provisions with service partners, which I think we say contracted partners. So all contracts with, no, that doesn't make sense. Let me just read it as is. All contract provisions with service partners shall be applied without discrimination as to race, color, national origin, marital status, age, gender, sexual orientation, religion, or disability.
Sounds good. And I just want to be clear, because this is the lawyer being annoying, and me. Sheila, did we get the list? Is that in I just want to make sure, where did you get that list?
Like all protected
Did we
categories.
get everybody?
Right.
Did we get everybody, or are we missing anyone?
I can't remember if I added gender, but what we drew it from a Delaware state policy around grievances. So I think that we're including all of the categories that the state currently
It looked good
recognizes.
to me. Just wanted to double check on that. Thank you.
Other protected categories yet to be envisioned.
There you go. Yeah.
Well, I guess the only one that jumps, I don't know if it's covered because things change, is gender identity. We have gender, but we don't have gender identity. I don't know if we need to include that.
Yeah, I wrestled with that and I just put the word gender, but it could be sexual and gender identity. Could, maybe that's a way, or maybe gender identity and sexual identity. But also, yeah, I agree with that.
I know there's so many terms out there, and I just hope we're doing the right thing, not just talking about it.
The only other thing, and this goes for the sort of the whole recommendation, is that we're using consistent language. So we've been calling them contracted partners through the other recommendations. Or I want to make sure we're using the same, we're calling them the same thing. So if we're calling them service, I don't think we call them service partners necessarily, but I don't know. I'm looking back. That's why
I'm fine with using the same language.
Yeah, I
that-
think we
that
call them
makes sense.
contracted partners. So that would be one thing I go through this one for, and just make sure that we're consistent throughout that.
I'm gonna digress on this one just to say, by saying contracted partners, it implies that you need to have the contract for that fair consideration. In most of the other bullets, I think it's contracted partners. In this particular bullet, I think it is
For the one of this.
for this
Okay,
particular one,
equity.
it should be open to all
Sure. Okay.
all potential service providers intending to
gotcha.
contract with,
Okay.
because we want that application to apply even before they get a contract.
Candidates,
Candidates,
all
potential service contracting provider candidates.
A contract shall be awarded without,
Yeah.
contracts shall be awarded and contract provisions shall be applied.
There you go. Yep. Without.
Discrimination, and I think we should add gender
Considered.
identity.
Also considered and awarded.
Yeah, that's good. And I agree with Kirsten. I in looking at our recommended best practices we're going through a national accreditation. They include gender and gender identity as two
is
separate
two
items.
things, yeah.
Okay. Okay. This is going to sound jumbled, but I want to run through it one more time. I don't know that this is right either. As a guiding principle, the contract subcommittee of the DHSS Reorganization Committee shall consider and award contracts to service partners without discrimination as to race, color, national origin, marital status, age, gender, sexual orientation, religion, or disability.
Should
You
it say
forgot gender identity.
And you missed the recommend, right?
Yeah, I was going to say recommends to
Recommend
the state.
that.
Yeah, recommends that.
I believe as a guiding principle of the contract subcommittee of the DHSS Reorganization Committee recommends all contracts shall be considered and awarded without blah, 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 blah. And you want it to say age, comma, gender identity, comma, sexual orientation, or gender, comma, gender identity?
Gender combat, gender identity.
Okay.
And Carolyn, should it also say, is wordsmithing by committee the funnest thing you've ever done? That recommends that contracts shall be considered and awarded and contract provisions shall be applied. Because there's the two, there's the beginning and then there's the.
So stressful. Contracts shall be considered and awarded. Correct. Considered and awarded. And what was that?
And contract provisions shall be applied without discrimination. List.
Okay. 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 Do I have to read it over again? One more time. Okay. Okay. I really hope I got it right. As a guiding principle, the contract subcommittee of the DHSS Reorganization Committee recommends all contract provisions. No, all contract. Where am I? All contracts shall be all contracts shall be considered and awarded, and contract provisions shall be applied without discrimination as to race, blah, 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 blah.
You got it.
Amen.
You better type that up real fast, Carol.
Yeah, I'm calling all of you. I got all your
If it was
stuff.
a chat, I would have chatted it in.
Calling all of you after this to make sure. Okay. Pinning that. Anything else to recommendation number 4? It follows a little different bit of a structure than the other ones, which I don't necessarily have an issue with. I just don't want to skip over anything and then we finalize it and then we think about that later. I'm just trying to be thorough and consistent. Like, we're leaving it fairly general as the mechanism without a definition of what the mechanism is.
So
I have
current 4 becomes current recommendation 4 and 5. And those 2, as I believe, I think that they're covered and we can move on to the annual report one. Is that your question, Carolyn?
no.
Oh, sorry.
Okay, I don't know at this point. No, my question was going to be, do we want, we want to keep it general so that it is flexible enough for them to operationalize on their side, but also specific enough to achieve. Like, we're not putting it out there and, that's the balance. And that's the balance with everything we've done so far. I don't want to ask them to do something that they can't because we've been too specific, or that they can't because it's not defined enough. So I'm fine with the way it is. And that sort of bleeds into the next one, the annual report too. This is a general question more so than specific to this recommendation, which is fine. So if everybody's cool, then I'm cool. Okay. Good. Okay. Last one. Okay. Recommendation 5 and annual report. The department shall provide an annual report that analyzes the contractual and procurement efficiencies and effectiveness across all divisions. This report shall provide an evaluation of, but not limited to, and that's because I wanted to make sure if anybody else thought of anything that I missed. Average length of time for payment to all vendors by division and line of service when applicable. So the similar report that Wendy had given us at the very beginning, I think it's important to see how that's trending periodically. Tracking by division of contracts, including type of contract. For example, service provision, professional consulting services, supplies, and other types of service. Medical loss ratio from the prior year, that's the amount that went unspent with Medicaid through the MCOs and is returned. Analysis of total, and that's a year, that takes a year. So like the numbers that just came in this past like February were 2019, not 2020. So that's like, it's always delayed a year. Analysis of total Medicaid, Medicare dollars received, including a breakdown by spending on direct services, percentage retained by MCOs and percentage retained by the state for administration of Delaware directed CMS monies. And breakdown of federal medical assistance program percentage FMAP dollars accessed by investment from state budget allocation for community-based services. And then the only outlier is this report shall be submitted to, and I put September, the end of September only to give them time to do so. I mean, I would hope this is something they're sort of keeping track of all year. But making it like end of third quarter, they've gotten through legislative session in that first month when everything sort of shuts down, and it gives them that like hole at the end of the summer before the new sort of, legislative year starts kicking up and the budget year starts kicking up. So I just would like obviously comment on it, but then I was thinking the legislative committees for health. But I don't know, I don't want to put work on, I don't know that I have the authority to put work on legislators' plates. So
Typically, I think those reports just go to the General Assembly. I think it said something like that. I think that's where it should go, like to just a blanket General Assembly. I don't know.
you would know better than me. I'm fine with that. And I would think maybe Senator Poore and the other legislators on the full committee might probably want to weigh in on that as well. Is there anything as far as the 1, 2, 3, 4, 5, which I can change to bullets if we want to be consistent with bullets? It's fine. The only other thing I thought about after I submitted this was keep track of evergreen contracts. And I know we were looking at how many of, like when we first came together, Wendy had a report of how many there were. And then I believe Michelle reported out when we started coming back together in January and February of how many less there were. I don't know if that's something that would be accurate. Like, it's not worth reporting if that number alone doesn't necessarily tell you what you want to know. So I'm going to leave that up to you guys to weigh in on. But any other comments or changes, or did you pick up any typos?
I thought that Michelle had mentioned that the evergreens would be eliminated at some point within this year. So, and that seems to be the track that the couple that we have are on for. So I think they're going away in general. So I don't know that it would be worth adding that as a layer. Kimberly, I see you shaking your head.
Don't do it.
One head.
Yes, we are eliminating evergreen contracts, so we're no longer engaging in them, and the ones that are in place, we are adding end dates to them. So
Okay. And I know that there had been, from the time that Wendy first, sort of engaged with us and we got that first trough of information, I know that a lot has changed. So
yeah.
So it's one of those things that pop into your head while you're trying to fall asleep.
Okay.
Okay. Anything else on this?
I just want to say it's a great idea. So glad you included it.
Thank you. Anything else? What did I say last time, Kirsten? commiserate. That was brilliant. Okay. So I'll leave it, I'll change that to the General Assembly. This report shall be submitted to the General Assembly by September 30th annually. And then certainly if the full committee has any further ideas or comments on that, we'll go from there. I feel like I need to read the other one again. Recommendation number 6. I'm really scared about it. I'll write it, and when I send all this out for edit, it should most definitely reflect all those changes. So, any other comments or thoughts from the committee as I am ready to ask for a motion, but I want to make sure that there's no last minute anything, because now would be the time to talk about it. We have 8 minutes.
My only suggestion, and it's probably feeding my OCD, would be that we take the newest recommendation and move it to the very end as
That's what I was
sort of
thinking.
a
Yep,
closing statement.
that was my intention.
I
Yeah.
agree. And so does Dolly.
Aw. Okay. All right. Well, then I'm going to ask for a motion to approve the 6 recommendations with the aforementioned edits and changes as discussed.
So moved.
Allowing non-substantive edits
Yes.
after the completion. Okay.
So moved with what Pam said.
We're so official. Okay.
Second.
Do I have a second?
I'll second it.
Okay. Any opposed? Contract Subcommittee has approved our 6 recommendations. Unless some table gets flipped somewhere in the universe, the work of the Contract Subcommittee. Thank you so much for your dedication over the last 1.5 years to this work, especially given how immensely stressed you all are. And that goes for you guys too at DHSS, Kimberly, and please extend my thanks to Michelle and leadership for your cooperation and your assistance. I really, truly hope this work proves to mean wonderful things for you all, but most assuredly those that you serve. We don't do this work because we are gobbling up vacation homes on coast to coast or diamonds and pearls, but we're here because of our passion for the missions of the people we serve. So I thank you for your time and service to this cause. And with that, I'm gonna adjourn.
Okay.
Carol,
Everyone.
Wait,
Thank you, Alexa, for all your hard work.
wait, sorry.
Oh, public comment.
And we have not approved the minutes from the previous meeting.
Oh.
So we can do public comment first because that'll be quick, and then you'll have to approve the minutes, and then you can adjourn.
Okay.
So the meeting
So
will now,
eloquent too. All right, take it all
That
back.
was a great speech too, Carolyn.
You got to repeat it though.
All-
the meeting will now be open for public comment. If you want to provide public comment, please raise your hand now. There is no one from the public in attendance, so that will close the public comment period.
Okay, and the minutes from March 29th. Wah, wah, wah.
They looked fine, except my name was misspelled
In the beginning or through the middle?
through the whole thing.
We'll change that. I apologize.
OLSON.
Thank you. I will change that right away before submitting it to be posted.
Thanks, Alexa.
Anybody else? Good. Okay, a motion to approve the minutes.
I'm motion
So
to
moved.
approve.
Okay, and
Sorry,
second.
Jeannie.
And second. Any opposed? Okay. All All right, the minutes from March 29th are approved, and I want to rewind, think about that great motivational speech I just gave everybody, rewind, pretend that just all came out of my mouth now. Go about your Wednesdays like I did that the right way. And thank you again, and thank you, Alexa, for your work on this. And DTI, thank you too.
Thanks, everyone.
Thank you, Carolyn. Thank you,
Have a
Representative.
good day.